I'm thrilled to have Gabby Abalafia with us tonight. She joined our program in May about the Momnibus bill. And when the steering committee was talking about what do we do now? Well, how do we follow up on the cost of segregation? And how does this affect women especially? And I thought, aha, Gabby works at the Commonwealth Fund. She's going to be perfect. And I've had conversations with her before. She's so excited about and passionate about everything. And she said, I'll keep going. And I said, that's okay. We'll tell you when it's time to move on, but it's your passion and understanding and deep understanding of it, of the issues of the cost of segregation. The other thing I'm going to do, which I haven't done before, is to attach a reading list, because she recommended a book called The Sum of Us that I started to read, and it's very, very powerful. So I'm going to add, we're going to work on it afterwards and send the whole thing, so send you the whole list as a separate item. So Gabby, I'm going to turn this over to you and have you tell us a little bit more about yourself than I went into, and then tell us about the cost of segregation.
Okay. Hi, everyone. This is exciting. I'm Gabby. Beth is my great aunt. I don't know if that connection was made clear or not.
No, I was going to wait till the end, but that's okay.
Well, there you go. On my mom's side, sorry, I'm going to get distracted by the chat box. But like Beth said, I work at the Commonwealth Fund, and basically what we do, we're based in New York, but we've been working remotely since the beginning of the pandemic. So I've been in my parents' house in Houston. So a lot of, like Beth said, geographic variation happening. But we do internal research, and we also support research, health policy related research. So we fund a lot of different things. My team focuses on healthcare coverage and access. And so it's really just following health insurance trends in the country, as well as a lot of the cost related access barriers that people face. And it's all domestic. So we have a really, really, really cool international health policy team. But I guess I'm interested in international stuff, but my knowledge sort of, it's about what's happening in the US. So did you want me to get started or wait, or?
We've got 25 people, so I think you can get started.
Okay.
Yeah. Do you want to?
Sorry, I'm just.
Yeah. Okay. You're
yeah.
There. Okay. And I said, if you have questions, enter them in the chat box. This is our usual format. And then Gabby will answer them at the end.
Okay. Can you see? Is that fine?
Yep.
Okay.
Gorgeous.
So just get my phone, make sure I don't. Tell me when I run out of time, if I'm talking too much, too fast, whatever, because I don't know. So today I'm going to be talking about the cost of segregation, and specifically how racialized health policy decisions affect everyone. And as I was pulling this together, I was just like, health policy in general is a really, really good example of racialized politics. You could literally pick any different type of insurance in the country and just the insurance system in general and sort of parse out how race and racism affect our decisions. But today, because we only have 30 minutes and that's going to be hard, I'm just going to be talking about Medicaid and Medicaid expansion specifically. So the first part of the presentation, I want to go over kind of like what Medicaid is, what expansion is, provide a bit more of context. Some of you probably already know a lot of this. And then for the other kind of half, I want to go into the politics and race and really how these decisions have impacted people across the country. Let me just make this smaller. Okay, so what is Medicaid? At a really, really high level, it's health insurance coverage for low income adults and children. And a big point that I really want to make sure, like one of your big takeaways is that what and who is covered really, really depends on where you are. So the type of services you receive, as well as if you get healthcare or not, depends on where you live completely. And this used to be a bit more fragmented before the ACA, which I'm going to talk about, but it still really varies depending on where you are. It's jointly administered by states and the federal government. So what that means is the federal government kind of sets like guardrails. They're not super great in my opinion, but they say, okay, you have to kind of cover these people, provide these services, and then states kind of take that and implement it in their own way. So that's where a lot of the variation comes from. Another big thing related to this is that it's jointly financed by states and the federal government. So for every dollar that a state spends, the federal government will match that. And something that's really interesting is that it's called like it's a matching rate. And so poorer states actually get more money from the federal government for their Medicaid program, which is an important point that will become a bit more clear why it's important later throughout the presentation. As of the beginning of this year, just over 80 million people, which is including kids and adults, had Medicaid coverage. So this is a pretty significant program. Every 1 in 5 Americans is covered by Medicaid. So it's like 20% of people. And I don't know, sorry, we have 2 big dogs. So if you can hear them, but 20%. And I lost my train of thought, sorry. Oh, a really important point that I wanted to make, so I don't have my notes because I'm sharing my screen. Almost half of all births in the country are covered by Medicaid, which I think is really, really important and not a lot of people know. Another important thing that I think is a big misunderstanding people have, most of the people who have Medicaid coverage are actually white. If you were to group categories into white versus non-white, well, then obviously the remaining basically 60% of non-white people, or the remaining 60% are non-white people. But if you were to look at groups individually, so like white, Black, Hispanic, and so on, the white people actually comprise the majority of people who have Medicaid coverage, which I think is important to know. The other thing is that people of color are disproportionately represented among those with Medicaid coverage. So that means that, for example, like 13%-ish of the population is Black, but 33% of Black people have Medicaid coverage. So if it was proportional, it'd be 13% would have Medicaid coverage as well. So that's why Medicaid is really viewed as a policy that can advance equity, because it covers a disproportionate number of people of color. Also, Medicaid is like a really, really stigmatized program. I think it's stigmatized in a lot of different ways, both by, politicians and how they talk about it, as well as people and the public in discourse. And I think obviously that's really informed by politicians. Something else that's, I think, important to consider is it's also stigmatized by people who are like ostensibly trying to help people navigate the application process. So a lot of like signing up and enrolling in Medicaid and maintaining that coverage is really administratively burdensome. And a lot of times people are made to feel like not smart. And it's a really, really challenging thing. Like experts will literally say, people who study for this for a living will literally say, I tried to help signing someone up for Medicaid and I had no idea like what was going on. And so I think and people who are trying to sign up really, really feel that. So Medicaid and the Affordable Care Act. So I assume you all know some stuff about the ACA. That could, the ACA, we could have like a day-long presentation on. But for this presentation, I'm just focusing mostly on how the ACA expanded Medicaid. And the ACA, most significant piece of healthcare legislation since Medicare and Medicaid were passed in 1965, so pretty big deal. So before the ACA, Medicaid was even more restrictive and variable than it is now. You basically, first and foremost, had to fall into a certain category. You had to be a certain type of person in order to get coverage, to even, be considered for coverage. So you had to be like a pregnant woman, a parent with dependents, an individual with some type of disability, and then some older people also would qualify. And then if you fell into one of those categories, you also had to have, you couldn't have more than a certain amount in savings, your assets, and you also had to fall below an income limit. And so at the time, it really, really was a health insurance program for the deserving poor. I think, pregnant women, older women, people with disabilities are people who really like command empathy and politics. And so if you were a low income, like working age person in it before, you like did not, or poor working person before, working age person, you did not qualify for Medicaid. So in 2010, the ACA expanded Medicaid to any adult making at or below 138% of the federal poverty level, which in dollar terms, that's about $18,000 for an individual and a little over $36,000 for a family of four in annual income in 2021. But in 2012, as a result of one of the many Supreme Court decisions relating to the ACA, the court decided that Medicaid expansion, they ruled that Medicaid expansion was optional, so states could pick whether or not they were going to expand. So before I get into who expanded and who didn't, I wanted to touch on why states would want to expand Medicaid in the first place. And I had to include the first point because we are all human, because that's just how I think. And I would imagine a lot of you think, just from like the moral argument that people deserve healthcare. But another really big thing is that for the first couple of years after states expanded Medicaid, so states were able to start expanding in 2014, through 2016, the federal government was literally going to pay for 100% of the costs associated with the newly eligible expansion population through 2016. They still did and do cover a significant portion of that. So now it's phased down to, to 90%. There was a provision in one of the recent rescue plan packages that would change that, but no state has taken it up. But so now states who have expanded are responsible for just 10% of the cost associated with this newly eligible expansion population. And that would be the case if, like, spoiler alert, Texas didn't expand Medicaid. Like, that would be the case if Texas expanded today. The other big thing is that states are already paying for it. Just because people don't have health insurance coverage and access to healthcare doesn't mean they're getting sick and won't use it eventually. So you end up with people who are sicker and consequently more expensive because they end up in the ER, which someone has to pay for eventually, with worse health conditions than they would have had they just received services that they needed to begin with. And there were also a good example is Montana, I was actually reading about earlier. There were these separate state funded health programs for those without insurance. So in Montana, for example, they had like a substance abuse treatment program before Medicaid expansion. But once the state expanded, Medicaid actually covered treatment programs for people with substance abuse issues. And so the state isn't actually funding that separate program now because it's covered through the Medicaid expansion services. So this is the best way I think anyone could explain the politics of Medicaid expansion. So it's two maps, and I did not come up with this. I know this is being recorded. One of my favorite professors, I went to UNC in Chapel Hill for undergrad, and he showed it this way one time on Twitter, and this is what I think about all the time. So on the left is the status of state Medicaid expansion decisions as of this year, and the states in orange are the ones that have not expanded. The light blue state, Missouri, is kind of on its way to expanding, but I wouldn't consider it fully expand. It hasn't fully expanded yet. And then the dark blue states are the ones that have expanded. And then on the right, the states in the gray are the states of the Confederacy or slave states. And as you can see, I mean, most of these states that haven't expanded are concentrated in the South. And what's even more, it used to be even more striking, I think, because I think there were 25 states that expanded right at the beginning, and then some states followed later on. Before Virginia and Louisiana didn't expand, they expanded relatively recently. So you actually had pretty much all the states except Arkansas that hadn't expanded. So I think this is really, really striking and has a ton of racial equity implications that I'm going to get into. But before I do that, I just want to explain what it means in practical terms for an individual to live in a state that hasn't expanded Medicaid. So you kind of fall into this gap, except I was thinking about it today and it's not really a gap. It's really either you're covered or you're not, basically, especially if you're in a place like Texas. So one of the other things that the ACA did was it established these marketplaces, which is where essentially people who aren't offered coverage through their employer can come and get health insurance. So individual coverage. And one of the really great things about it is that there are these subsidies available for people who make between 138% and 400% of poverty. But for states that expanded Medicaid, they widened the eligibility a little bit. So it's for people who make between 100 and 400% of poverty. But basically that means if you don't make 100% of poverty, if you make below 100% of poverty, you aren't eligible for these subsidies, and you're in a state that hasn't expanded Medicaid, you like pretty much have no options. So especially if you're just a poor adult with no kids, no disability, anything like I said before, you have literally no options. But even for people who do fall into these groups, for example, Texas, it's not on here, but it's like an adult, a parent of a child in Texas in a family of 3, so 2 parents and 1 child, has to be making can't be making any more than 17% of poverty, which literally means like less than $300 a month. And that's the only way that you're able to be eligible for coverage. If you exceed that, you can't. And so you have to be like indigent, like you can't be making any money. And so I don't know, I think gap is not necessarily the way to describe it, because it's really, really hard to qualify in some of these states if you haven't expanded. So most of the adults who are excluded from Medicaid are in Texas or Georgia. Pretty much all of them live in the South. So over 50% either live in, this should say Florida, I'm sorry. I don't know why I wrote Georgia, but this should say Florida, Texas or Florida. And so they're in one of these 2 states, and there are about 2.2 million people in the coverage gap. So it's a pretty significant, I don't know, portion of the population, especially considering like, yeah, these are the people who had the least access to begin with. So I also think this map is pretty striking. The states that have not expanded have some of the highest shares of Black people and Latinx and Hispanic people as well. But the states that are outlined in red are the ones that haven't expanded, and the darker blue states are the ones that have higher shares of Black people in their state. And as you can see, the same exact states, same exact thing is happening, where the states with more Black people actually haven't expanded their programs. So there's just one more like statistic relating to this. Nearly half of all of the poorest Black adults live in a state that has not expanded Medicaid, which I also find very striking. 38% of all of the poorest Latinx or Hispanic adults live in a non-expansion state, and 34% of all of the poorest white adults live in a non-expansion state as well. So the next 2 slides, I think there are a few researchers who have done a lot of really cool work on this, who I pulled a lot of quotes from. So this slide is from an article by Jamila Michener. She's a professor at Cornell University. She's like super cool. And she does a lot on poverty and policy and race. And her big thing is Medicaid. And she wrote this article on race. I think I have it, Race, Politics, and the Affordable Care Act. And one of the quotes that I pulled at the top is, race intersects with politics to render policy less equitable. And she basically does like this mini literature review, and she finds these empirical studies that have actually shown that this is like in terms of public opinion, racial resentment was linked to Medicaid expansion or non-expansion decisions, and white adults were much less likely to support the expansion of Medicaid, and states are way more responsive to white opinion. So that second point means that like, even if you had a state where there was more representation from Black adults and they were saying we support Medicaid expansion, the legislature was still more responsive to the white opinion. And this quote I also think was very good. I guess you can read it. I don't need to read it, but basically her point is that my point in pulling all of this together is that it's politicians kind of feeding you all these ideas, but it's a lot about what people think, and it's a lot about what white people think, and I don't know, really thinking about white identity and how people don't want to be how white people don't want to be associated with Black or Latino people or whatever it is, like really drove a lot of this, even though as I'll show in a little bit, white people really, really have benefited and still could benefit from Medicaid expansion. So this is one more book that I can't remember if you said that I recommended this, but this is a book called there's another good book kind of related to this. It's called Dying of Whiteness, How the Politics of Racial Resentment is Killing America's Heartland. And it's by a professor, his name is Jonathan Metzl. He's a researcher at Vanderbilt. And he went to 3 states. It was Kansas, Missouri, and Tennessee, all states that have an expanded Medicaid. And he talks to different people, white and Black, about sort of their thoughts on really everything, but like the ACA, Medicaid, health reform. And this quote I thought was really good. This is at the beginning of the book when he was talking to someone who was quite literally dying on his bed because he was sick, and he was obviously in a non-expansion state, and he would have gotten Medicaid had his state expanded, but was actually in the situation sick because his state hadn't. And it says, Trevor voiced a literal willingness to die for his place in this hierarchy rather than participate in a system that might put him on the same plane as immigrants or racial minorities. And again, I just think this gets at like people, a lot of white people just don't want to be associated with people of color. And I mean, throughout the book, they call them like welfare queens, the like illegals, the immigrants, the Latinas, whatever it may be. But I don't know. I think it's very striking if you have a chance to read the book, what people say and how a lot of also people express like they were like, this is white people. They're like, I deserve it because I work hard, but like those other people, aka like people of color, don't. And it's all very racially charged and motivated. So if you have a chance to read that, I would recommend it. So my point in saying all of this is to try to provide background, but also to really show that like, I want to explain that like everyone, like low income people in all states that have been expanded have been affected by this. And I didn't include any of this, and I can, but the literature, I mean, it's like voluminous. It's study after study after study that has shown how effective Medicaid has been in like helping people like improve their lives in terms of health, but also like in financial outcomes. There's some really compelling work about how Medicaid expansion has literally been like linked to a decrease in the rate of evictions and poverty. And that's because like, obviously, once you cover people's healthcare costs, they have more money to spend on other things and actually kind of be able to live their lives. And I don't think we always think about sort of the financial and all the economic implications of doing something like this for people. But anyway, Medicaid has like really, really worked for people, and it's been really great. And obviously there are studies that show maybe sometimes the evidence is conflicted, but I mean, it's been very, very positive. And this just shows sort of like what happens in states that haven't expanded. So the top bar in each of the groups, the orange is the uninsured rate in expansion states, and the bottom, the blue, is the uninsured rate in non-expansion states. And you can see across well, I only highlight Latinx and Hispanic and Black and white here, but across these 3 racial and ethnic groups, the uninsured rate is way higher for each group in expansion or in non-expansion states. Oh my gosh, these should be flipped too. I don't know what I was doing. The colors are actually flipped, obviously, maybe not obviously, hopefully, you know that, but they're actually, oh my goodness, the colors are mixed up. So the higher rates for each of them would be the uninsured rate in non-expansion states, and the lower rates would be the uninsured rate in expansion states. So like for white people, in the uninsured rate in non-expansion states is literally almost twice what it is in non-expansion state or in expansion states, excuse me. So my point is that everyone is affected by this. Once again, if you look at the distribution, not the rate, 40% of all people in the coverage gap are white, which is really, really important. This, like I've tried to explain, disproportionately has harmed people of color, namely Black and Latinx and Hispanic people. But again, the majority of people are actually white. 28% are Black and 28% are Hispanic or Latinx. Health system resources are drained in states that haven't expanded Medicaid for a number of reasons, but kind of getting at, this is related to what I talked about earlier, just in terms of people still go to get to the emergency room to get healthcare, but their conditions are a lot worse because they didn't get the healthcare they needed to begin with. And where you live totally determines if you are able to access healthcare. I've been thinking about this a lot kind of recently, and I'm not the person who I like feel bad for or would advocate for, because I'm okay and we'll figure it out. But like, I'm going to graduate school and I'm about to be 26 and I've been on my parents' health insurance for forever. But now that's going to end in February of 2022, which is nuts. But I've started to think about what I'm going to do for health insurance, and I'm going to Massachusetts, which is actually a little bit different, so probably not a good example, but a state that has expanded Medicaid, that would actually be an option for me because I won't be making a lot of money in graduate school. So I would actually probably fall below the income requirement. But if I were to stay in Texas, like no way, I would have to get student health insurance. So it limits options in that way. Also, for older people, you can actually have there are some people who actually have Medicare and Medicaid. And like a lot of you probably know, Medicare, there are a lot of gaps and it doesn't cover everything. And Medicaid is something like Medicaid covers, not in all states, but in some states like Illinois, really, really extensive dental benefits Medicaid has. So if you were in Illinois and you had qualified for Medicaid before because your Social Security or whatever you had put you below the income threshold, that definitely would not happen if you moved here. And so it's really constricting. And I mean, for like poor people, like it's not like, oh, maybe I can figure something out. Like there really is no option for them. And so it's pretty incredible that this has happened. And this is still a thing. In the middle of the pandemic, there were a ton of incentives that were there was a big incentive put into one bill in hopes that states would expand, and they're still not taking it, which is, incredible to me. So I tried to think about what you all can do. And most of the action surrounding Medicaid expansion is happening at the federal level, just because in order for a state to expand, it happens at the state legislature, but that isn't going to happen in any of these states that haven't expanded at this point, or I don't think it will happen. So Congress is really trying to find a way to create some sort of better option for people who fall in this gap. So again, most of this is happening in Congress. One of the things that you can do is you can contact your senators and tell them to support one of the recent, it's called the Medicaid Saves Lives Act, and it's the most recent piece of legislation. It was introduced by Ossoff and Warnock in Georgia, and then Tammy Baldwin in Wisconsin, and Georgia and Wisconsin are two states that have an expanded Medicaid. And it creates an option for people who are in non-expansion states. And there are obviously there have been other bills introduced, not exactly like this, but there are other things that have come up, I imagine will come up to try to address this. So I think being on the lookout for those types of things and ways you can tell, and when you can tell your senators and representatives to sign on, and then also just following Medicaid related legislation and waivers that will affect Illinois. I bulleted two things that are relevant to the state, but one of the cool things, not all states use it in a good way, that you're able to do with Medicaid is you have these different waivers that allow states to test sort of different programs and ways that they're supposed to like help Medicaid beneficiaries. And so there are a lot of waivers that like during the Trump administration, they weren't waivers that I would necessarily agree with, but there are some waivers now that are being approved by the Biden administration that really enhance and expand benefits. So anything related to Medicaid that's happening in Illinois, I would follow. And usually, again, if it's relating to enhancing or expanding the benefits in any way, I would 100% recommend trying to voice your support for those types of things. And that, I think, was all. Yeah, that was all I had on this. I don't know. Yeah. Do you want to?
Yeah, I don't see any questions in the chat box. So interesting. I didn't realize there was actually an act that needs to be supported, the Medicaid Saves Lives Act. And I'm with another group, I'm meeting with Durban tomorrow. And so that's definitely a question that I'm going to ask, is to support it. And generally, Durban and Duckworth support these things, but they need an extra push to not only support it, but to be very proactive. And I think here in Illinois, that's how most of us feel. So that's good to know. And I'm trying to think, you had given an example about if you're a senior in Texas, you have different benefits than if you're a senior in Illinois. How dramatically things change, how dramatically different it is for an expanded state, a state with expanded Medicare.
Well, so it would be expanded Medicaid, expanded Medicare, they're working on that, but that would be one of the interesting, distinct and important distinctions between Medicare and Medicaid is that Medicare, it's all run by the federal government. And so that's why there isn't as much like there isn't as much variation across states, right? Because each state, one time someone once told me like, if you know one state's Medicaid program, like you only know one state's Medicaid program, there's literally no like, I can work in a Medicaid agency in Texas and then go to Illinois and have no idea what I'm doing. And so that's not the case with Medicare. And so, yeah, so expanded Medicaid is the important thing. But yeah, I think it just, so you can have both. They're called like dual beneficiaries. But yeah, that if you had Medicaid coverage as a senior in Illinois, like you definitely wouldn't have it in here where I am for sure. Especially for dental service. I mean, dental care is a whole other thing, but especially coming here, which is pretty incredible. Like,
yeah, we have a question from Betty Magnus. How does Senator Duckworth's amendment to allow people on Medicaid diapers? In other words, what's the status now?
I don't actually know. I saw that. I'm not sure what that is.
Can I explain it?
Sure. Thanks, Betty.
So Senator Duckworth has entered some legislation. I thought it would be affected by Medicaid. People who are a part of the Medicaid program, when they get stamps, they cannot purchase diapers with those stamps. They can't purchase diapers. They can't purchase sanitary products, that kind of thing. She entered some legislation and I didn't know what the status of it was. And your presentation, can I just say, was actually awesome. For years, I've worked with Reverend Jackson. He has always maintained that back in the day, it was called public aid, that there were the majority of the people on public aid, now Medicaid, were young and white, the majority in terms of numbers. And to hear you say that just kind of verifies what he's been saying all along. But I just was curious about what the status was with Senator Duckworth's legislation.
Yeah, I was trying to look it up. I don't know if that was.
I don't think that was Medicaid.
Yeah.
I think that was through the food stamps.
Yeah.
It was through a different program, but it should be Medicaid. It should be paid for. It's ridiculous that it is.
I thought you had to be on Medicaid in order to get the food stamps.
That might be.
No, so
that was why I asked.
Just because you're at a certain economic level. That may be related. It might be state to state though, Betty. Whether
yeah, and it's really, that's also very, I mean, probably not surprising, but federalism, like I think Medicaid is a perfect example of why it doesn't work very well. And it's like, there are different programs where if you qualify for one, you automatically get the other, but that isn't the case. It's not consistent, and they have enough data. If it was organized, I think it would be better to do this, but they don't. And I mean, that ends up working in favor of states that want less people to have Medicaid coverage. But yeah, I think the white part is like really, really, really important because it's like so stigmatized, and people are like, once again, like this book, Dying of Whiteness, welfare queens, all of these things. It's like, actually, no, it's like a lot of white people. And, it kind of reminds me of like when people talk about the politics of like the opioid epidemic, where they're like, oh, people are more understanding or whatever because it's white people. Well, maybe, I mean, I think this is absurd, but maybe if you actually knew that these were white people, maybe people would care more. I'm not really sure, but it's all very not great. But I think it's important because people don't know that. So.
Gabby, do you think what I get out of this, and I worked when I used to work, I was a psychologist and I worked a lot with a lot of these programs. But do you think that these things should be state to state, or it should be a federal program like Medicare is? Medicare is not a problem because it's a federal program. Do you think Medicaid should also be just a federal program?
I do, but I'm speaking on behalf, like, this is based on what I think. I mean, I think my views on healthcare, maybe they're very, very progressive, just being kind of immersed in everything I have been, but I think so. I think there are also problems with Medicare that people bring up that you all, are probably familiar with as well. But I think it should be, because you just end up having like, they were literally paying for all the costs and states didn't do it, So I don't know how much more you can give to incentivize states to move.
Yeah, it's so inconsistent. It should just be everyone's covered through
Right.
a program. It's ridiculous.
And I guess the argument is like, states know their people best. Well, clearly not. Like, I can speak from Texas. Like, I don't think they know what I want, but, and I do think there are like state specific needs for sure, because people are in different industries, whatever. But I mean, people need to go to the doctor, period. So, I mean, you literally cannot do anything if you are poor in a state that hasn't expanded. And it's just, I don't know. It's also interesting. Like, I had my bat mitzvah. I was like 13. I was literally having my bat mitzvah when the Affordable Care Act was passed. So I don't really know what people were talking about then, but like the fact that more people aren't talking about this all the time, just that there are people who are literally being denied these services in states because of their governor and legislature is just, I don't know.
Well, you're certainly inspiring us.
I
Let me mention.
And you're educating us. I did not
Yeah.
know there was this Medicaid Saves Lives Act, and we're going to start pushing that.
Yeah.
That's great.
We're gonna follow up on it. Yeah.
Yeah.
Something from the chat box, Jill Lexier said that SNAP is another way to get diapers. I think that's what you meant, Jill.
That is how you get it right now. But
Yeah.
Betty was saying that Medicaid and SNAP are related, and that may very well be.
Okay. And Carol Levine said that there's some workarounds for the non-expansion states to bypass the state legislature and get funding directly to hospitals and agencies. Do you know anything about that?
Yeah, so it's all like really confusing, but it's like dish payments. They're all these different acronyms, but I think there are some ways for certain like health systems, I believe, to get funding. I don't know a ton about this. I'm like really coverage focused. So that's all I know, but there isn't, yeah. That was probably not a helpful answer, sorry.
Well, I think that's something for us to find out about. That's really important.
That's a new legislation that Carol is talking about. I've seen and read about it. And they were working out a way, the Biden administration was working out a way to get the money directly to the people who needed it and bypass the governors who were refusing to take the money.
Well, that's great. We need to know what it is so we can.
We'll do some
the bill
follow-up.
numbers.
We have another question. Have you any data on estimated cost to general taxpayers from these policies, from higher healthcare, et cetera?
There definitely are data that exist. I would have to look it up. I don't know the numbers off the top of my head. There are also some really compelling studies that have been done about states. And it's really interesting because you have these like control group, you have states who've expanded and states who haven't, but there are actually studies that have been done on certain states that have shown, this is to try to get other states to move in the right direction and to expand, that have actually shown how much states have saved by implementing Medicaid expansion, because it's actually, you're literally bringing revenue into the state because it's a matching rate. So the federal government is paying you money to do these things. And so there are studies that do that as well, but I would have to look up, there are data on this, but I don't have them off the top of my head.
that's okay.
I can send them to
Covered an
you.
awful lot of things, so.
If you send it, Gabby, Beth will send it out to us.
Yeah, I can,
Yeah.
no, I'll note it.
Yeah,
to
no,
send it
we'll
to you.
follow up with this. Jill says it's very disappointing that we haven't learned from COVID about the importance of healthcare for all. I assume that some of this data is still being chunked. I mean, and it's getting it published. That's what will be coming around and helping
Well,
push the case.
that's been the thing that's been disappointing to me, is because we are really research oriented, like we're all about the data. And as someone, I mean, we just keep putting out study after study after study. And I mean, it's about politics and who you're helping and who people don't want to help. And so in my opinion, I actually think, like, I studied health policy in undergrad, and there was one class, my favorite class was about politics, but we didn't really talk about it. But clearly, I mean, if you can't tell from the public health crisis, like politics dictates like so much of what happens. And, you know, it's not, there aren't a lot of political scientists who study health policy, which is really fascinating to me, considering how inherent, I mean, it's how political it really is. But I agree. And the question about, like, do I think Medicaid should be federal? I mean, I think we should have some type of national health insurance program for everyone. Because I still think at the end of the day, you're splitting people into categories, like, who cares, right? Like, this is still, I mean, it is all categorical in a way. But, and then also, I mean, people, even if you have private insurance coverage, it's not great for a lot of people too. So yeah, it is really disappointing.
Anything else that would help us do something? And of course, again, we live in states that we have Durban and Duckworth. I'm trying to think. I know we talked with, I had wonderful discussion with the people from EverThrive, and our reproductive health and justice committee is pretty active, keeping us up to date. So
I'm trying to think.
anyone else have any questions? So anyhow, so in Illinois, we've got lots more work to do. Definitely. And I love your examples of putting people, of saying, I'm 25 and what do I do in February when I turn 26?
Yeah.
That's very helpful, you know, putting a name and a face to it, and oh my gosh. And how dramatic the difference will be between Massachusetts, where you'll be a resident, and your home state.
Mhm.
So these are terrific examples.
Yeah, I also, thank God, I'm like in pretty, knock on wood, in good health. And so I also just can't imagine being someone who really, you know, I don't know, has some type of disease or health condition and making this move. Like, I mean, it really determines where you go and where you can go and where you can't. Whereas me, it's like, I'm gonna go to school because I'm gonna go to school. You know, I think for a lot of people, it's kind of like, I was thinking about this earlier, it's kind of like, my parents have said, you know, we picked this neighborhood because of the schools, the infrastructure, whatever that's here. Well, I'd never thought about people picking where to live because of healthcare services,
Yeah.
Which is, yeah.
And you're right. I think people do just think of within their state, but that's a whole different thing of, do you go from one state to another state because of what's going on? Yeah. That's a good, real good point. I have some other questions. Have you research that shows the cost of county hospitals has gone down when people have the Affordable Care Act? Let me do that again. Do you have research that shows that the cost of county hospitals has gone down when people have the health insurance through the Affordable Care Act?
Yeah. Also, there's in terms of rural hospitals, there's a lot of data about how rural hospital closures in states that haven't expanded Medicaid, because you're literally, I mean, you're not paying people. So that's a really, really big thing. So the converse of that would be, I mean, I don't know about the overall cost going down, but hospitals are literally closing in areas where they haven't, or in states that haven't expanded Medicaid in rural areas, because Medicaid, I mean, it's Medicaid pays, and the reason why, I don't know what people know, what people don't, but the reason why a lot of places will like deny people with Medicaid is because Medicaid pays at lower rates than Medicare and private insurance, but getting 40% or whatever it is more than like nothing and being out of all of that money. So there are actually, again, a lot of cases where hospitals have had to close down because the state hasn't expanded.
And
We were hearing that county hospital was literally overrun with people because people were using the emergency room as the doctor.
Yeah, I mean, that's what they do.
Didn't go until it was an emergency. And then I haven't heard the president of the county board or the commissioners talk about that exorbitant cost rate for Stroger Hospital as much since ACA went into effect. And I was just wondering if that is kind of the case across the country.
Yeah. Yeah, I don't know. I'm sure there is. I'm sure actually probably in North Carolina where I was, they have a really cool research center. I'm sure there is. I can also look for that to see, but my hypothesis would be that that is out there.
We have another question from Jill. Can you,
That's right.
are you reading it?
Oh, I was reading the last one. Sounds like many
Okay.
people do know and they just don't care. I think that's it.
Or it also sounds like the paperwork is so involved.
Yeah, and that's what I don't know if I think we sent this podcast around, the Ezra Klein one, or with Jamila Mitch. Maybe we didn't. I don't know if I didn't.
I don't know that people have read it. I've just started to read
Well,
Heather McGee's book. Yeah.
yes. So there were a few good podcasts I meant to send to you if I didn't, but
Don't worry.
like this woman, Jamila Mitchner, who's at Cornell, literally studies health policy. So she like explained, she was like, I was walking my mom through how to sign up. And it was like ridiculous. Like I had no idea, like I was confused. And it's also like, they make it really, really hard for you to maintain your coverage. So there are all these checkpoints and you have to re-sign up and resubmit all this paperwork. Like you have to submit all your pay stuff. Like it's just ridiculous. Like I had to just apply for a lease in Boston, had to get all this paperwork. Like it took me a few days. Like I didn't know where anything was. I mean, people have to do this like every 6 months. And so also what people are really worried about is in one of the first COVID bills actually that Trump signed, they basically states can kick people off of Medicaid automatically if they don't re-enroll themselves. And that there's a lot of things you have to go through to do that. But what this bill did was it prevented states from kicking people off until the end of the public health emergency, which I believe actually just ended. And so people are worried that now you're going to have like a lot of people being kicked off of Medicaid because there was this whole period of time where you didn't have to re-enroll or whatever, but that's like a huge thing as well. That's like a really big barrier for people. And it's not like the onus isn't on the people who are trying to enroll like, oh, they're less educated, oh, this or that. It's like, no, like this documentation was like made complicated for a reason to confuse people. So
yeah, it sounds like it really, really was done on purpose.
Yeah.
Difficult.
And again, the onus is not on the people who are trying to enroll. Like it's on the people who design these things, right? So, and I also think we don't talk about that a lot either. But yeah, it's pretty depressing to think about. So
yeah, it really, really is. Well, does anyone have any additional questions? Gabby, I don't think you're following it. Everyone's saying thank you so much for clarifying some of these. They're not issues, they're facts that are incredibly complicated and purposely so. So this has really, really helped us. And thank you so much. And full disclosure, yes, Gabby's my great niece. And not only is she going to graduate school in the fall at Harvard in the MPP program, Master of Arts in Public Policy. So this is just wonderful and we're thrilled for you and for sharing this with us. And so yes, thank you.
Oh my God. My parents are screaming. I don't know if you can hear them. We're in the same house giving a presentation.
And
Or while
I'm going to,
giving a presentation.
I'm going to
Fantastic.
yes, yes. And as Jill said, thank you for this important and disturbing information. Yeah.
Yeah, I'm gonna try to find the stuff that I don't know about and send you some links. I
Okay,
mean,
that
people
would
have
be
done like the research on the ACA and Medicaid expansion. I mean, people have done so much. And again, I kind of know the coverage stuff. Like I wish I needed to know more about the rural stuff as well, but there's a lot out there. So I'm sure
You're
people,
doing it.
sorry?
I said, you're doing it. This is
Oh,
fantastic.
well, I'm sure people have answered these questions, have thought about these questions, for sure. So I will definitely look into it. And
Okay.
see what I can
And
find.
let me tempt everyone else with what's coming up. On August 23rd, Jane Ramsey is going to talk about the ECPS, but this is a really important legislation, or I don't know, that's legislation that went through in Chicago called Empowering Communities for Public Safety. Citizens of Chicago are going to have a big input into what happens in our police department. So, and we can't tell you what she's going to talk about because it's a moving target, except what is it and explaining what we can do, what we need to do. Our October.
Beth, you need to know that they're talking about our legislation all over the country. Chicago has been the first city that's really pulled off that legislation, and we are the model for people all over the country to pick it up.
Which is so incredible when you think about where we've come from. Yep. So thank you, Betty. That's absolutely. And our October, we have a 3-part spotlight about propaganda. What is it? What can we do about it? And we've got fantastic speakers lined up. You'll get tons of information about it. And Jan Schwartz is in charge of that. And a lot of us here are involved in it as well. So we're excited about that. We've just come up with 2 other programs in November and December. And November is going to be an update on the Voting Rights Act. And again, we don't know what's going on, and it's July, and it's a lot of change between now and then, but we will have the most current information then. And then December, we're going to have an interesting program about what is advocacy? What does it mean? If you just click on something that says contact your legislator and everything gets filled in automatically, you're doing something. How that builds into people like Betty and Carol Levine and all of our people that work about 80 hours a week on doing this, on the various topics that we're all involved in. So that carries us through the year. We'd love to have other people on the steering committee. We've come up with our mission, which is to provide a platform to examine and discuss current social justice issues. And then the engaged individuals then act to transform their communities. And that's exactly what we're doing. So, Gabby, thank you so much. This is just wonderful. This really brought everything home to us.
Yeah.
So
I'm going to try to answer your questions. I'm going to go look everything up now.
okay.
Send me some good stuff I can hopefully try to find.
Yeah. And then you and I will come up with what we're sometime by the end of this week, we'll send information to everyone about it. So we are all set. Thank you again. Thank you everyone for attending.
Thank you.
And we'll see you next month. So
Bye.
thank you again. And we'll get you out, get everyone out there, all the questions that you still had. So thank you all. Have a good evening.